We are in Keta in the Volta region of Ghana, known for its beautiful beaches and its hard-working people. Uniquely, 35% of Keta's landmass is covered in water, like the lagoon you see behind me. With a population of just over 200,000 people, Keta serves as a commercial nerve center for all of the small towns and villages that surround it. Keta is an important center for healthcare in this area. The whole municipality has just 2 hospitals, including the Keta Municipal Hospital behind me. There are no special facilities for women and children, and the facilities that do exist are often outdated or run down. The hospital resources are under severe pressure, and the staff is left struggling to treat patients with adequate care. Each doctor, and there are only 2 of them, attends to an average of 29,000 people. And there is 1 nurse for every 1,500 patients.
Dr. Derek Martin. I'm actually a general practitioner here in Keta Municipal Hospital. I'm in charge of the maternity unit. Together with the other doctors, see most of the cases here. Our daily routine is usually pretty hectic because we are really short of staff. We are only 2 doctors here.
Most days, patients have a long wait before they see a doctor. Getting your card from the outpatients department can take 2 to 3 hours, and another hour or so before the nurse takes your temperature and blood pressure. Then there's another long queue, and yet another hour or 2 before the patient sees the doctor.
We usually work 24/7. I must confess, it gets to a time it's really stressful. There are a few times you feel like just running off a little, but
the staff here is hardworking and dedicated, but significantly, the hospital does not have a functioning blood bank or standby ambulance. This can lead to tragic outcomes, as was the case of Charity.
She was bleeding so much, there was no way we could refer anywhere. We had to go in. She arrested many times, and we don't have a ventilator to ventilate her, and unfortunately she died.
Sadly, maternal deaths are still too frequent. Many people would say that each death is 1 too many, and most families have a story to tell. We attended Charity's funeral at her family house. She was born here and grew up into a young lady looking forward to a bright future. She left for Nigeria in her late teens, where she met her husband and gave birth to 5 children. She lost the 6th through a cesarean operation and developed severe complications with her 7th. When her condition deteriorated, Charity took one of the longest journeys of her life back to Ghana. Sadly, she lost her life at Keta Municipal Hospital.
Keta Hospital now, they did the operation normal, the way I saw it. I thought there's no problem. But before we know, she's give up.
Maternal deaths come at such a high human cost. Children lose their mothers, husbands lose their wives, and families lose a loved one. Women are such pivotal supports in the family, and when one dies, especially at such a young age, it affects the whole community. Many people here speak fondly of her and speak of her kindness and her bubbly character. Everyone came and gave their last respects at her funeral. A few miles from Charity's house is the home of Madame Agbemava, who also recently lost her daughter when she went to the hospital to give birth. The photographs evoke instant memories. For a grieving mother, it all seemed like yesterday. Jennifer had not delivered weeks after she was due. After complications exacerbated by delays at the hospital, she died.
I'm not against that. What you said is you have helped me.
The moment to deliver the bad news came. The doctor walked into the room with a red pen, a known symbol of a bad omen here.
My heart cut and I saw him holding the pen. And then she said how many children I have. because of the red pen. I asked him, even if I have 20 children, that is why you shouldn't have my daughter. She would die. And when I said that, then I fainted. And she didn't deliver. I thought she died with the baby. Jennifer, Jijo.
This is Charity's final resting place. Most would say she's gone too soon. In a profound sense, her life did not have to end so abruptly. What is to be done to ensure that another woman does not suffer the same fate that Charity did is the message from Keta.